Hi, this is Andrea Kane, and I'm here again talking about medical terminology. This is HSC 1114, Chapter 6, and let's see what we're up to now. We are still in the digestive system, but we're looking at additional suffixes and terminology. Our chapter goals are pretty much the same. We are still learning. This time we'll probably be looking at some more lab tests and other things. And we're still on Unit 2 for our syllabus, our learning goals, learning objectives. So let's take a look at these suffixes. These are additional ones that you'll be wanting to learn. This tells you what they are, what their meaning is. And here are more. Again, all of these should be in your book. This is just a really good review. Now these are suffixes that can be used alone as terms in and of themselves. So emesis or emetic, that's vomiting. Lysis is when you are cutting, stopping, those types of things, or pulling apart. Lysis of adhesions is where you'll hear that the most, is when they're doing abdominal surgery on someone and they have to lyse adhesions. And that's where they're pulling them apart. They're taking these pieces off of the intestine. And usually it's very common for them to tear because your intestines are very, very delicate things. And if you get an adhesion that is attached to your intestine, which is very common, it's just really hard to pull apart. And so tears are almost a given doing that. Spasm. You've probably heard of spasms. Someone spazzing out might be a common thing you've heard, but it's actually more of a reaction. Stasis and stenosis. Stasis, we talked about that, sort of stopping, and stenosis is a narrowing. So if we're thinking about difficulty swallowing, now this is a really good one because P-H-A-S-I-A, aphasia, is speech. Phagia with a G is swallowing. So you have to be really careful. The difference between that S and that G can mean big things. One is speech, the other one is swallowing. So make sure you're aware of that. And then notice also between B and C, phagia is swallowing, plasia is a growth. So again, between an H and an L, that makes a big difference. So I've given you lots of hints. You should get it right. Which term means to control or stop bleeding? Well, which one does not mean blood? Think of what means blood. Now think of what means to stop. And that should help you. Some more combining forms. Notice they all end with O, the roots and the combining vowels, except for chole. Now make sure that you pay really good attention to chole. Chole is C-H-O-L, and its combining vowel is an E, not an I, not an O, but an E, chole. It's that old gallbladder. And here are more. Most of these are familiar because they were in Chapter 5 as well. Not a whole lot of different ones, but just really kind of a review and somewhat of an expansion. All right, which term means enlarged liver? Well, the easiest one is to start with what means liver. And then think about what means enlarged, and that should help you reach the answer. So what are some lab tests that we see with the digestive system? Well, you're going to hear of LFTs, liver function tests. You're testing for enzymes and bilirubin in the blood. They'll tell you if somebody has abnormal LFTs, that there's something going on. You often hear about stool cultures where they're looking to see what in the world is in someone's stool to see if they are going to need some antibiotics or some kind of other situation. People who often visit foreign countries that may pick up some kind of a parasite, and that's a way they can look for that as well. Hematocult tests. Those are looking to see if there's blood. And as I was talking about earlier, a lot of times when there's blood in the feces, it's a sign that there's something really wrong with the colon. Can mean that there's colon cancer in there. Might need to have a sigmoidoscopy to take a look. Um, hmm. Let's see if there's anything else. You might hear of amylase and lipase tests, looking at enzyme levels. So, which of the following tests for the clear fluid that remains after the blood has clotted? Okay. You're looking for clear fluid. This is a tough one. You might have to go back to your book to find the answer on this one. All right, clinical procedures, x-rays. We'll get into this with radiology chapter soon. That's also this week, week 2. But you're going to hear about barium enemas. You're going to hear about upper and lower GI series. You're going to hear about with or without contrast, CT scans, cholangiograms, those types of things. Ultrasounds can be done, MRIs, nuclear medicine tests. There's a HIDA scan that you may hear about. There are surgeries, different procedures that are done on the GI tract. There's a bypass, there's bariatric surgery, there's GI endoscopies, laparoscopies. Laparotomy is where they open up and take a peek around too. Liver biopsies. You may hear about NG tubes. That's usually to feed someone, tube feedings, those types of things. And then there's paracentesis, where you're removing fluid from the abdomen. Fluid in the abdomen is not a good sign. Oftentimes, fluid in the abdomen can indicate that there's some kind of abdominal cancer going on. And I think I just gave that away on the previous slide, so you should easily be able to get that one. And here are some abbreviations that you're going to want to be aware of. And more. And still more. And here are some suffixes. Some of these you've seen before. Some of them are review, and some of them are new. Make sure on these R ones that it's RRH. I know that doesn't sound right, but when you're spelling, mentally think RRH. If you're doing rage, raja, uraphy, RRH, or RIA, RRH. All right, that's it for chapter 6. And I will be back shortly to talk about chapters 19 and 20. Talk to you later.